Question more about the elephant in the room that people aren't really talking too much about, which is the science of acoustic emission and squeaking, which is the problem. It's no longer aware. I think we developed a tremendous amount of science in the 1990s and the 2000s, led by a lot of the work that you've done on understanding wear in hard-on-hard bearings. Some work was done in 2003, 2005, when squeaking started to emerge as a big issue with a certain type of design of stem and ceramic head, alumina for sure. But I don't see that same level of attention placed on understanding acoustic emissions in modern ceramic resurfacing yet. Is that work going on? And will it be reported to give people, when this eventually comes to North America, like people are going to want to understand and not just be told, oh, don't worry about it, it's not a problem. Like, has someone academically studied it and can report actual data with the same kind of rigor that people study wear with?
Well, we guys in Europe kind of like to send things that challenge Americans to think out of the box a little bit, and maybe we got some way to go. But the fact is that really this is more a clinical question, because you don't need acoustic equipment to hear it. You can hear it with your own ears, and the patient can kind of hear it, and I have a feeling they sort of feel it because it's in their bone structure. So are they really hearing it? The fact is, what I'm hearing from the clinicians involved in resurf and delta motion before that is that it's completely benign. It's there, but then everything that moves makes a noise. It's a question of whether we can hear it, and then whether we hear it, it's nice and musical, or we don't like it, and laugh at it when we go to a meeting, but only in America.
So there's two different elements here. There's the volume of it and the duration of it. And we've been recording, because it's a very real issue, anyone who's reported a noise, we've tried to record it. And the longest we've heard is 80 milliseconds. So it's pretty short. And I think and because you can only generate it by squeezing the fluid film out in deep flexion, and that's how you generate the noise, and you generate it as you go back into the wear scar. And it's just that junctional area, and that's the length of time. The volume is very low, so it's definitely audible, but it's not loud. You can hear, and the last thing about it, unlike the metal transfer, that's, it's a 40-degree or 50-degree stripe of titanium that will get louder and louder. They don't seem to get more and more with time. So we haven't seen one occur before 3 months, and we haven't heard one after 2 years. I'm just saying it's empirical data. It's not science-based.
It's a difficult thing to do as a test to patients, because when you give them a questionnaire for any of these studies, you've got a kind of hint for them to report on something, which if they haven't noticed, isn't there.
The loudest we've had, the loudest one lately is ceramic on highly cross-linked poly, total hip. Really a loud noise. And that's ceramic on highly cross-linked poly, louder than any BHR. BHRs have a very similar noise.
It's going to be very disappointing when it comes, I think. There's going to be a lot of people who would love to put squeaking messages on the screens. They'll have to cheat. It is, the other thing that's noticeable there is the range of motion. I think Justin sort of touched on that, but I think Bill Walter, who I don't think is here at the moment, he sent us a video of a lady who got it to happen and could do it predictably, because not many of them can actually reproduce it when they come to see the clinician. This was a lady who tied her young son's two shoelaces up by bending over only from her hips, keeping her knees straight. And then it squeaked as she was tying the shoelace up, as she then came back.
Justin.
It's an extreme range of motion, so it's probably very little actual motion and load which is going to do much damage.